On Mamamia's new women's health podcast, Well, you might learn a thing or two about your very own body. Like that polycystic ovarian syndrome has nothing to do with cysts, that burnout is real and treatable, that the G-spot is elusive for a very good reason, and where the sperm goes that doesn't fertilise the egg. We're talking about how to sleep better, how to make babies, and even how to check ourselves into rehab. No matter how unusual or embarrassing your health question is, Well is here for you. Join me, Claire Murphy, and my amazing co-host Dr Mariam for Well, dropping every Thursday. Well, brought to you by Chemist Warehouse, wherever you get your podcasts.
Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth, and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome, everyone. Well, I guess you've picked up this quick kick because you've panicked, because you've found yourself sleeping on your back, or you are a consistent back sleeper and you're wondering about the damage that you're doing to your baby. Firstly, I want to say that back sleeping is really common, and I did happen to find a study from Norway that reported about 37% of people like to sleep on their back. And this just doesn't change because you're pregnant. Sleeping on your back in pregnancy can be a real cause of worry because we listen to what's on socials, we talk to our friends, we talk to our doctors, and we think all of a sudden we've done something that is harming the baby. In this quick kick, we talk about whether it's an absolute blanket rule, whether you shouldn't sleep on your back or not. So let's get into it.
Hi, Dr. Pat and Brigid. My name is Rebecca. I'm currently 33 weeks pregnant with my second baby. I was lucky enough to have Dr. Pat deliver my first little boy who's just turned 2. My question is about sleeping on your back in your 3rd trimester of pregnancy. I know it's not recommended, but I'd be really interested to know what the actual evidence suggests in terms of whether it's safe or not. I'm definitely find myself more comfortable sleeping on my back and will often wake up that way in the middle of the night and then turn on my side. So, just if we could hear about the actual scientific proof, whether that's good or bad for the baby.
Okay, nice to hear from one of our own patients.
Yeah.
That's very nice. I think that this is a good one because people sometimes feel a bit kind of guilty about that, especially if they're back sleepers and they wake up in the back and they go, no, what have I done? I don't know for sure, but my understanding of this effect, it's based on the anatomy. So when you've got a great big pregnancy at the front of your body, and if you're lying flat on your back, the pregnancy is enough to squish the inferior vena cava, which is bringing blood back from your legs back up to your heart for recirculation. And if that IVC is squished, then there's less blood going into the right side of the heart, so there's less blood coming out the left side of the heart. And one of the things that the cardiac output, the blood coming out of the heart, is sending blood to is the uterus. So if we squish the blood going back, we're getting at the other end of the chain less blood going into the uterus, and that can upset the baby. And we've all seen this when we've had a woman on the operating table for a cesarean section. If she's lying directly on her back with a spinal anaesthetic in, it can really affect the happiness of the baby. So we use that little chock under the bum cheek to tilt the patient slightly to one side, and things improve. It's not known, as far as I know, exactly how important this is to fetal well-being. But what we strongly suspect is that it's probably not terribly important to a perfectly healthy, well-grown, chubby, bouncing baby. But it could be very important to a baby that's growth restricted, a small placenta, calcified placenta, preeclampsia, diabetes, where that baby needs everything going its way.
Yeah.
Yeah. So I make more of a fuss about this in pregnancies of suspected fetal compromise. and that it might be that baby just needs every duck in a row, whereas a baby that's awesome probably much more able to withstand a brief insult from
lying on someone's back.
Woman being on her back.
I think one other thing that we've talked about before is that if they're worried, and that worry is causing an issue as well, like, they're feeling very stressed because every night they find themselves awake and they're on their back, good to take heart if their baby's healthy in a healthy weight. But if not, then maybe, use a bolster or something behind your back.
You can put those pregnancy pillows behind your back to make it very uncomfortable to roll onto your back.
Yeah.
Or like snorers do, put some,
That's what we need for you.
Yeah. And sew a tennis ball into the back of the pajamas so that it would be very uncomfortable to lie straight on your back. But there's not tons we can do about it while we're asleep. So I often just say to people, if you wake up flat on your back, recommit yourself to being a side sleeper. Get back on your side and try again.
Yep, good. Good luck, Beck. Nice to hear from you. Thanks for listening to this quick kick, everyone. My tip that I'd like to add is sleeping is really disrupted anyway in pregnancy. Some people say it's just to get us used to the sleep deprivation that happens when the baby comes, but I reckon that's just mean. My tip is to increase your comfort by pregnancy pillows. There are some on the market that are just game changers, and what it takes is a bit of experimentation. It's all about how you position your pillow. For example, you can put them between your knees if you have knee pain or pelvic girdle pain. You can have the ones that sort of cradle your tummy and your back at the same time. The one that I felt really useful was to have a pillow between my arms because it helped with some thoracic pain I was getting. The theory behind this is if you're having a comfortable sleep, then you might just stay on your side and have less need to roll into your favourite back sleeping position. Good luck if you are a back sleeper. I wish you the best of sleep for the rest of your pregnancy.
Struggling with the anxiety that comes with adulting?
Or maybe you've suddenly become the parent to your parents.
Wondering if you might have ADHD, but unsure if or how to get a diagnosis?
I'm clinical psychologist Dr Anastasia Horonis.
And I'm Ashani Dante. We're your hosts of But Are You Happy?
Bringing you all the self-development and mental health information you actually need.
New episodes drop every Saturday morning.
Just in time for your hot girl walk.
So tune in to But Are You Happy? The podcast where overthinking finally gets the spotlight it deserves. Made in partnership with Medibank.
Well, everyone, we're going to do a double whammy quick kick.
Double whammy quick kick.
Is that such a thing? Because for very, very observant people, you might have noticed that you are now being tested for, wait for it, syphilis 3 times during the pregnancy. And we thought we better tell you a little bit more about syphilis because, Pat, I thought that was a disease that kind of no longer existed.
Yeah, it's amazing, isn't it? So this is the same syphilis that's been around for the history of humanity probably, and we read about in books from the Middle Ages.
And like French artists. There was a syphilis then, wasn't there?
Yeah, that's right. So,
back in the 1900s.
Unfortunately, it still exists. And whilst in a lot of populations it was almost eradicated, it was only almost. And unfortunately, in the last few years in Australia and in our state of Victoria, there's been a real resurgence.
Oh, that's amazing.
The numbers are still pretty small compared to, say, chlamydia, but the consequences are very serious, in particular for the babies of infected mothers.
When you say very small, like what sort of numbers are we talking?
Well, if you look at congenital syphilis, which is babies born having been infected with syphilis during the pregnancy, in 2017, between 2017 and 2024, there were 19 cases. Okay, doesn't sound terrible, huge number, but very, very serious for those babies. It can be fatal. And in the previous 25 years to that period, there were only 2 cases.
Yeah, wow.
Yeah, so it's back, and it's back in a group of people who are having babies. So we're seeing it in young people in the baby years. Yeah.
You mentioned chlamydia, and we've never done an episode on STDs or STIs, but like they're pretty prevalent, aren't they?
Oh, sure, they are, and there's each particular infection, gonorrhea, chlamydia, syphilis, they've all got their sort of ways of behaving as a microorganism. They've all got spread patterns and groups that tend to get them, and each one has an attached public health message as to how we can keep them under control. And the public health message around syphilis has changed. So everyone has had a syphilis test in their first lot of antenatal blood tests for certainly my entire career and long before that, I'm sure. So that, and people think, what the hell is that for?
Yeah.
Well, it's testing to see whether you have been exposed to syphilis in the past, and you right now are perfectly well, but you could infect the baby during the pregnancy. And once in a blue moon, someone turns up positive for that test. And now they're suggesting, wait for it, that you tested 3 times during pregnancy.
Yeah, wow.
Yeah. Now, the convenient bit is it's attached to a blood test you're having.
Yeah. You don't have to go in specifically to have this blood test.
So it's always been attached to that first lot. You know, that first lot you have when you first find out you're pregnant, that's got a blood group, rubella, hepatitis B, HIV. And then now the public health authorities are strongly recommending it's attached to the 28-week bloods, which is the diabetes test, and the 36-week bloods, which is a rechecking of blood group antibodies and hemoglobin.
Now, are we thinking that we just missed it in the first test, or is this just because, I don't know, we can't be sure?
Yeah, that's not entirely clear from my reading, but I suspect both. So I suspect that they, want us to check 3 times to catch everybody, but also there's doubtless some people who are being infected during pregnancy. Yeah. And they want to find those people who perhaps weren't infected at 9-10 weeks when the first bloods were done, but are positive by 28.
Now, I don't want to worry lots of people by listening to this and think, I don't even know anything about syphilis. Like, what are the common symptoms that someone might exhibit if they've got syphilis?
Yeah, well, I guess that's part of the problem, is that typically if you're first infected with syphilis as a sexual exposure, it causes a little ulcer on the genitals at the time, which is painless and could easily be mistaken for something else, or ignored by the patient, or misdiagnosed by a doctor. And then that goes away. And later on, there's this secondary phase where the person's actually quite sick. But again, unless the history of the painless ulcer is picked up, that may be mistaken for something else. And very, very rarely in our community, but historically, there was a phase of what was called tertiary syphilis, where it spread to your brain and caused neurological and mental health problems. So the problem with it is that it can be a little hard to diagnose as an infectious problem, and as an STI.
Yeah, right. And what about when a baby's born? Would they sort of know that mum has syphilis and are then on the lookout for when the baby's born?
Yeah, well, that's the idea, that we would because it's very, very treatable. Okay, so when we read about the kings of Europe having syphilis in the 1300s, they didn't have penicillin, but it's very, very sensitive to plain old ordinary penicillin. None of the fancy antibiotics we've got these days. So it can be easily treated. And of course that stops spread and stops risk.
Parenting podcasts can be a bit earnest. Parenting Out Loud is not that podcast.
This person, who I may not agree with politically, is trying to talk about integrating children, not just into his professional life, but into public life.
I have referred to myself as one and done. That article did make me rethink the term.
It took about 11 seconds for this to go viral.
Oh God, is this the ejaculate one? That is deranged, and I love it.
Parenting changes the way you see everything. Parenting Out Loud takes the big conversations of the moment and puts them through that filter.
Because if parents are thinking about it, we're talking about it.
Parenting Out Loud. Listen weekly wherever you get your podcasts.
Does it get rid of it?
Yes,
Cancer?
absolutely.
Oh, wow.
Yeah.
Okay.
So you can be completely treated and it's cured.
Yeah.
But we're worried about the people where damage is done,
Mm.
and we're also worried about the spread to babies. Yeah.
Well, I suppose the message too is like, you just having the blood test, you probably don't know that you're actually having that blood test, what boxes have been ticked.
Mm.
You might look at your own path results and go,
What the hell?
they tested me for syphilis.
Yeah.
So that's really why we wanted to bring it to people's attention. This is why you're being tested for syphilis.
That's right. And I think we should be thinking of it in much the same as, say, the HIV test with the first round of bloods. It's not that most people in Australia who are getting pregnant are at high risk of HIV. It's just that vertical transmission can be prevented.
Yeah.
So if we find the odd person who's HIV positive in early pregnancy in Australia who wasn't already known to be HIV positive, we can make every effort with that family to prevent vertical transmission from mother to baby.
Yeah. And I suppose the secondary message might be that if you are having multiple partners during a pregnancy, that you still have to have good, safe sex.
Absolutely. So that's the other half of the public health message. And even though we're testing everybody because of the sort of unique problem of vertical transmission, mother to baby, there's no doubt that the syphilis problem in the broad community, it disproportionately affects people with some high-risk sexual behaviours.
Yeah. All right, Pat, is that all you wanted to say about syphilis?
I think that people should be aware of what they're being tested for.
Yeah.
It shouldn't be a surprise if 3 syphilis tests come up on your My Health record on your phone.
Yeah, no one's making a judgment about it.
You are not considered high risk. That is standard treatment.
Yeah, great. All right, everyone. Well, that's the double whammy quick kick for you. I hope that there's absolutely no segue between sleeping on your back and syphilis. It just is that we wanted to get this public health message out as soon as we could. So there you go.
Thanks for listening, everybody.
Until next week, we'll see you then. I also wanted to take a minute to say thank you. Thank you for sharing our podcast with your friends. This is a fabulous way of helping them also along in their pregnancy journey. We love it when we hear that whole groups of friends are listening to The Kick, or when someone shares The Kick to their work team and they get to discuss the topics together. It just gives us such a thrill. So keep sharing, and until then, keep well, sleep well, and we'll be back in your ears next week. Bye for now. Hey, even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.